Medicare Part A helps pay for your hospital care, but what many people don't realize is how much they might still have to pay out of pocket. It can be a real shock. In the next few minutes, I'm going to break down exactly what Medicare Part A covers, what it costs you, and I'll share one common mistake that could end up costing you thousands of dollars. So, what exactly is Medicare Part A? Think of it as your hospital insurance. It's the part of original Medicare that specifically covers your care when you're admitted as an inpatient to a hospital. It also helps with costs for skilled nursing facilities, hospice care, and even some home health services. For most people, you become eligible and automatically enroll in Part A when you turn 65. As long as you or your spouse have worked and paid Medicare taxes. Let's dig a little deeper into what Part A actually covers. When you're admitted to a hospital, Part A helps pay for a semi-private room, your meals, and the general nursing care you receive. If you need short-term care in a skilled nursing facility after a qualifying hospital stay, Part A helps cover that too, but keep in mind it's for a limited time. It's not for long-term custodial care. Part A also provides coverage for hospice care if you're facing a terminal illness, focusing on comfort and quality of life. And finally, it can cover certain part-time home health services if they are deemed medically necessary, like skilled nursing care or physical therapy in your home. Now, let's talk about the costs, because this is where things get tricky. Most people get Part A. If you've worked and paid Medicare taxes for at least 10 years, you won't pay a monthly premium. But premium-free doesn't mean cost-free. There's a significant deductible you have to pay for each benefit period when you're admitted to the hospital. And if you have a hospital stay that lasts longer than 60 days, you'll start paying a daily coinsurance. And those costs can add up very, very quickly. This is a surprise for many people. So, what isn't covered by Part A? It's important to know the gaps. Part A does not cover the doctor's services you receive while in the hospital. That's typically covered by Part B. It also doesn't cover most prescription drugs, outpatient care, or any kind of long-term nursing home care. These services fall under other parts of Medicare, like Part B or Part D, or might require supplemental insurance. This brings me to the most common and costly mistake people make. They assume that just because they're in a hospital, Medicare Part A cover 100% of their bill. That's just not true. As we discussed, there are deductibles and daily copayments for long stays. Without some form of additional coverage, like a Medigap plan or a Medicare Advantage plan, a single extended hospital visit could leave you with a massive bill. So, to recap, Medicare Part A is your hospital insurance. It covers inpatient hospital care, but it comes with its own costs, like deductibles and coinsurance. Knowing the details of your coverage is the best way to protect yourself from unexpected and expensive medical bills. For more simple explanations just like this one, make sure you subscribe to our channel. Thanks for watching.